The Honourable Brian Walker.
Thank you, President. I rise to support the motion by my honourable colleague in the strongest possible terms. I'm speaking here from the perspective also of a medical practitioner who sees at the sharp end what happens as a result of government policies. Prefacing this, there are only three major pillars to any society. They are, of course, health, education and agriculture. Now, I'll speak more about the first two, health and education, but as my honourable colleague has pointed out, the inflation for the June quarter was 7.4%, and the offer of 3%, and that's been capped since 2017 as well, $1,000 a year. And what we're seeing, as he's laid out so very clearly here, is that actually we have wages going backwards. Let that sink in. Wages are going backwards. In a time when costs are going up, wages are going backwards in real terms. And people who are already not earning a great salary are having to deal with less of their insufficient funds. And we, as a government, surely must be prepared to stand up and say, this is just not right. Even the one-off cash offer which was made is not adequate. It's a one-off go, certainly. It has the risk of splitting the unions, who are then saying, well, I'll take the $2,500, yes, and I'll see if I can make do with the rest, and then dividing the problem so you can actually have more success at winning. This is not actually a successful way of managing society, and Unions WA has pointed this out, and I'm sure I'm speaking of one mind with my colleagues from the Labour Party. Now, the Legalised Cannabis WA is a party of social justice. Now, social justice is part of a free and fair society. Without social justice in a free and fair society, it's difficult to maintain democracy. Now, moving on to that from that one point there, we have here, I'll focus here on teachers and nurses, who are, of course, among the least well remunerated of all the public sector workers. Now, what does this message give us? The people who are educating our children are being paid not enough, and they're struggling to actually make headway in a difficult environment, which anyone who's actually looked after a teacher who's struggling with the stress and anxiety of being a teacher in difficult times will know you can't really pay them enough. And what about the nurses? Now, there's a lovely sign going around on car bumper stickers saying, nurses, you can't live without them. Well, you can't live with them either, I can tell you. But you can't live without them because they are the backbone of our health service. I mean, young doctors coming in who don't listen to what nurses say are in grave danger of killing their patients. We have highly qualified healthcare practitioners who are being paid a pittance. And this is actually disrespectful to some of the most important workers we have in our society. Disrespectful in that we're not giving them the remuneration adequate for their service. Now, it could be that they're working in these jobs because they want to sacrifice themselves, because they're aware that they're doing something good for the benefit of society, teaching children, caring for the sick. Okay? And I often tell nurses, well, you've got to screw loose. You see, you want to help people even when they don't want to be helped. We sacrifice in the healthcare professions. And as part of that sacrifice, you take on board, oh, they're not going to pay me as well, but it's a job worth doing. It's not that worth doing now when you're being hammered with the COVID we've had now, with the staff falling sick, the time off, being asked to work extra shifts, when you're suffering there in the hospital wards, unable to make a headway, when people are complaining and shouting at you, and you're not being respected by either your colleagues or by the environment, which is paying you a pittance. No wonder I can name a hospital where the 100% of the nurses would like to resign or retire now. That is not an organisation where you can guarantee quality of work because people are simply unable to face working for under very difficult conditions and getting paid a pittance, unless, of course, you need that money because there's no other source. And here we have it, not this freedom, because the Legalised Cannabis Party of Western Australia is also about freedom, autonomy. And if you're unable to be free in the choice of work, because there is not much available, and you get paid a pittance for that, then you actually are not a free person in this free and fair society. There's a pattern here. Now, I'm not going to say that doctors are paid a pittance. That's not true. But with this Medicare capping we've seen here, the Medicare income from bulk billing has not been raised or not adequately raised at all. So now doctors are having difficulty in funding their practice. They're paying their staff, they're paying their costs, they're paying their products. And it's difficult to do that when you're running very close to the edge of failure. Now, this means, of course, in real terms, is that you're going to stop bulk billing. And the people who need bulk billing most are the ones who are earning the least. And what we're then going to see, if the bulk billing system fails, is that those who need healthcare the most are going to be the ones deprived, leading to, of course, a health crisis. Can we in our society afford a health crisis? Can we afford that the people who need health most are the ones who are going to have the least options? It's not just not being able to see a doctor to check your blood pressure. It's about the poor food choices, because if you're not able to actually buy good quality food because it's expensive, the cheaper food is often this not real food, it's processed foods, which are definitely unhealthy. And if that's all you can afford, but you can fill the stomach of hungry children and yourself, that is what you will do. And what will you suffer by? You'll suffer with your health, reduced health, increased weight, increased diabetes, increased blood pressure, increased gut ill health with a chronic disease, autoimmune disease. Does that make you any more fit to work? It is the opposite. If you're not able to afford going out to exercise because you're working 2 jobs, you're going to find your physical health is impaired. This overload we're seeing here also in society leads to a mental crisis, mental health crisis. We're seeing nurses who are ending their shift in tears. Doctors too, for that matter. Teachers who are despairing, how can I do my job? With invidious circumstances and getting paid a pittance. They're burning out, they're leaving, and that's exacerbating the remaining workforce stress, who themselves are then more likely to face mental health. Now, the World Health Organization of Wellness is a definition which bears repeating. I've said it before. It's about physical health, mental health, social health, and financial health. And in every area of these 4 parameters, we are failing, I would put it to you. The Legalised Cannabis Party of WA is a party of wellness. The cost of food is going up. Petrol, we've all known that. The cost of rent is going up, leading then with all these complications to a physical, mental, financial, and social crisis. Leading, of course, then, as a consequence, to increased poverty, which results in increased crime and social disorder. So by not giving adequate remuneration to those who most need it, we are, in fact, encouraging destruction of our society. This is not just about the finances, it's about the well-being of our society. We need to stand up and be judged by the people for having failed society. The Legalised Cannabis WA supports the people of Western Australia, especially the disadvantaged, the oppressed, the unfairly treated, in a free and fair society. This is what we stand for. I've bypassed agriculture. You might think, well, the farmers are doing well. I don't think so. They may have a bumper harvest just now, but the stresses they are facing, especially when the food they are producing is not affordable because of the rising costs elsewhere in transport, then we're going to find that the farming, the agricultural industry is also going to be a part of this problem. So we're not, any of us, independent. We are all interdependent. And so all 3 areas of wellness are going to suffer. And as we all suffer, those at the lower end of the income scale are going to suffer most. And that is fundamentally unfair. Can we stand here in Parliament and support an unfair system? There are, of course, options. We can look at the Queensland example, where they're going for a 4%, but they've also added a potential 3% on top of that, should the base inflation be above 4%. 3%, so a total of 7% possible. It's possible. Is it perfect? No, it's not. I know our Premier has rejected that because of the inability to project the costs due to the variable 3% on top of that. Now, that makes economic sense, it does. But still, it doesn't reflect the need to help those who are disadvantaged more. Working very hard in essential services and getting paid a pittance, and an offer is made which doesn't cover the cost of inflation, resulting in your wages going backwards, is not an acceptable offer. Understandable, perhaps, if you didn't have enough money, but $5 billion in our coffers does surely give us some room to play. It does give us some room for movement. And I would put it to you that this is something we are honour-bound to do, because the people upon whom we depend are suffering. But if you then say, well, we've already apportioned all that fund, I would then be saying, and bearing in mind I'm from the Legalised Cannabis WA party, what about if we increase the state's wealth? What about if we stopped mucking around and pretending that THC is a problem? Let's free up the whole hemp industry. It's a multi-billion-dollar industry. I'm not talking about medical cannabis. I'm talking about hemp, the industrial hemp, which could add billions to our revenue, billions, and could then be useful at helping us to pay what is needed to be paid in a number of things, not just for the care, for the wages of the public sector workers, an adequate amount, an honourable amount, a respectable amount, but also for everything else that we need where we have not enough finances. The special care baby units, the child care centres where women and men can go about their work knowing their children are being cared for without having to give half of their already low salary in payment for that service. Fairness in society. This is what I'm asking us to look at. Fairness in our society is not just about giving a wage increase, it's about providing fairness to all. So Legalised Cannabis WA is also the party of fiscal common sense and good business. And we are aiming then for higher revenues, a balanced export trade, the iron ore and the hemp together being able to supply our needs. This would increase our state wealth, afford us a better outcome for all, including the public sector workers. And I heartily support this motion and commend it to the Chamber.